You heard of Seasonal Affective Disorder? Often referred to by its apt acronym, SAD, this type of depression is unique in its connection to the changing seasons. As the days grow shorter and sunlight becomes scarce, some people find their moods darkening in tandem. Symptoms of seasonal affective disorder can mimic those of other depressive disorders: persistent sadness, loss of interest in activities, fatigue, and changes in appetite or sleep patterns. However, the distinguishing factor here is the seasonal timing. This doesn't mean you're doomed to suffer every winter, though. Treatment options for SAD are varied and effective. Light therapy, which involves exposure to bright artificial light, tries to compensate for the lack of sunlight. Psychotherapy can also be beneficial. And of course, medication is an option for some. Remember, just as spring inevitably follows winter, there is always hope and help available. Seasonal affective disorder may be seasonal, but that doesn't make it any less real. Postpartum depression is a type that affects new mothers. It's a condition that can surface anywhere from a few days to a year after childbirth. It's characterized by feelings of extreme sadness, exhaustion, and sometimes anxiety. You may find it hard to care for your baby or feel a disconnect, even when you know you love them. Symptoms may include crying more often than usual, feeling angry, withdrawing from loved ones, doubting your ability to care for your baby, or even thinking about harming yourself or your baby. If you're experiencing any of these, it's crucial to reach out to a healthcare provider. Treatment options can range from therapy, medication, to self-care strategies. Remember, it's okay to seek help. Postpartum depression is not a sign of weakness or a character flaw. It's a medical condition that requires attention. And most importantly, it's not your fault. Postpartum depression is tough, but it's not a reflection of your ability as a mother. Premenstrual dysphoric disorder is a severe form of PMS. It's a health issue that affects many women, causing emotional and physical symptoms that can disrupt daily life. Imagine the worst PMS symptoms you've ever had, then amplify them. That's what premenstrual dysphoric disorder, or PMDD, can feel like. This disorder isn't just about having a tough time before your period. It's characterized by extreme mood swings, depression, anxiety, irritability, and even thoughts of suicide. Physical symptoms can include fatigue, bloating, and pain. But here's the good news. PMDD is treatable. A combination of lifestyle changes, medication, and therapy can help manage symptoms. Antidepressants, hormonal therapy, and nutritional supplements are some of the options available. Remember, if you're struggling with symptoms that go beyond what's considered normal PMS, it might be PMDD. Don't hesitate to reach out to a healthcare provider. Premenstrual dysphoric disorder is not just in your head, it's a valid and treatable condition. Last but not least, we have atypical depression. This type of depression, despite its name, is far from unusual. In fact, it's characterized by mood reactivity, meaning moods can improve in response to positive events. However, alongside these mood swings, individuals may experience increased appetite or weight gain, excessive sleep, a heavy feeling in the arms or legs, and sensitivity to rejection that affects personal relationships. Atypical depression can often be misdiagnosed because its symptoms are sometimes mistaken for personality traits or overlooked entirely. But just like any other form of depression, it's important to seek professional help. Treatment options include psychotherapy, medications like selective serotonin reuptake inhibitors or SSRIs, and lifestyle changes such as regular exercise and a balanced diet. While atypical depression may present differently than other forms of depression, it's crucial to remember that it's not less serious or impactful. Atypical depression may not fit the typical mold, but it's just as serious. We've journeyed through the vast landscape of depression, exploring its many forms, from major depressive disorder, characterized by a persistent feeling of sadness, to persistent depressive disorder, a long-term form of depression. We've delved into the complexities of bipolar disorder and understood how seasonal affective disorder is influenced by changes in seasons. We've also recognized the seriousness of postpartum depression that new mothers can experience, and the cyclical nature of premenstrual dysphoric disorder. We've even shed light on atypical depression, a type that doesn't necessarily follow the typical signs. In understanding these conditions, we emphasize the importance of seeking help. Knowledge is power, and understanding the various types of depression can inform our approach to treatment and support. Whether it's therapy, medication, lifestyle changes, or a mix, there's a path to feeling better. Remember, no matter the type of depression, you're not alone and help is available.